healthcare providers dedicate their entire lives to treating the sick and injured. Every day, the morning may start with 40 patients on the schedule, but by the day's end, only 32 patients show up. An all-too-familiar 20% no-show rate is, once again, repeated. 8 have decided that medical care is not their priority, which only worsens their condition and leads to the onset of chronic diseases. They usually end up in the emergency department for urgent treatment that could have been avoided. After treatment, some are discharged, while others require admissions due to the severity of their illness. Those who are admitted to the hospital receive excellent care by hospital staff and providers. Even so, a couple of patients are verbally abusive to staff. Though patient surveys are important in assessing the quality of care, not surprisingly, only the unhappy patients complete the survey. This gives a false negative narrative regarding patient perception of their treatment. During the admission, the providers are also required to follow mandatory government structured treatment guidelines, also known as core measures, or be penalized. The guidelines are confusing, onerous, and time-consuming, making their adherence impossible. As a result, the hospital is eventually labeled as a poor healthcare provider, and their compensation is lowered. Additional money is spent by the hospital to achieve core measure benchmarks. This, in turn, facilitates increasing costs. Over time, more surveys are submitted by unhappy patients, and additional guidelines are missed. Can this get any worse? Yes! After all the work is completed, the hospital and providers file insurance claims to receive payments. Payment is denied for frivolous administrative reasons. No one is paid, except perhaps a rogue provider offshore who deliberately defrauded the insurance company. Welcome to healthcare in the United States. Healthereum has decided to address these healthcare issues throughout the entire process, starting with the individual before they become a patient. Healthereum will reward accountability and healthy living by using blockchain token technology as proof of commitment. Healthereum creates a blockchain platform to reward those who follow up with their doctor. Every encounter between a provider and patient is now a smart contract. Healthereum will deliver care quality surveys instantly and reward those who complete them. The surveys will be delivered to any mobile device for quick and easy completion by all patients. More survey data means the hospitals will be able to make applicable and appropriate changes based on meaningful survey results. The hospitals will also be able to create in-house specific surveys to address any areas of interest. And, for the first time, a provider or hospital will rate a patient. This information is essential for tracking patient behavioral patterns, for both fidelity to their treatment protocol and their behavior towards healthcare providers. Mutual respect and civility are an important part of the healing process. Healthereum will also help hospitals and providers adhere to core measures, so the patient is treated with the expertise of the provider while still complying with governmental regulations. Every diagnosis becomes a smart contract tied to the encounter. This will ensure that every healthcare participant is continually fulfilling both their duty to provide the best patient care and meet the core measure data requirement. Finally, Healthereum will play an integral role in augmenting insurance claims management. The goal is to streamline payments between insurers, healthcare providers, and patients while eliminating fraudulent activities. Traditional unilateral claims will be verified by patients and leave a footprint on the blockchain. This will become a standard in claims management. The new Healthereum ecosystem is intertwined with blockchain to reward the motivated individuals, streamline delivery of quality care, adhere to government mandates, and assist in insurance claims payments. We welcome everyone to participate in improving their health and our entire U.S. healthcare system.